I think we can generally say that when a wound is sutured or the skin has come together on the surface, you're looking at just a couple of weeks. And what you see might be initially a flatter scar, but the process hasn't ended. And if there is a water loss from the surface and you're not effectively treating it by applying something to the surface, what's happening underneath is the buildup in the dermis, the second layer of the skin. There's a layer in there called the reticular layer, and it's where scar tissue is manufactured. And it has a lot to do with water. It has a lot to do with the irritation that happens within that layer, the inflammation. You need blood vessels to allow scar tissue to be formulated. There are several types of collagen. Collagen 1, which is usually seen in the best of the scars because it doesn't grow and it's not very dense. Most of normal, if we can say a scar is normal, has that in it. But once you get into a thicker scar, you get cross-sectioning and collagen goes crazy. It builds up heavily, and the fibroblasts, one of the cells that manufacture it, depending on irritation, depending on the kind of fibroblasts that are there, how you're trying to treat it, it's hidden from the surface view of the patient, and they think they're doing okay until months go by and this starts to spread out and become very big. Once it's densely thickened, there are not many things that you can do to it by application of something to the surface. So what you're always going to have to be aware of, be aware that that process is only the beginning. And even though you have a scar on the surface, you're not treating this with silicone sheeting or gel to imagine that your surface will get better. You're treating it more long-term to try to prevent the process of collagen from taking on abnormalities in its growth cycle. And you do that for months. And sometimes there'll be a tip-off as to the redness of a scar. Some of the scars that are getting thicker, they're also getting more red. They also are building up, and they may, in fact, start to get wider. There are products that can be injected into scars, but we're trying to deal with something that precedes or precludes the use of having to do surgery. Silicone, either as a sheet or as a gel, can be applied to a scar, maybe once the stitches are removed, and you do this daily. And you do it for months, not just for weeks. Silicone gel has been fashioned to be a sheet, and it's applied onto a scar, and the ideal way to deal with it is to use it maybe just at night when you're sleeping. You don't want to leave it on for a long period of time because you might get moisture building up around it. Silicone sheeting has permeability. You can get water coming through it, but sometimes water and moisture can go the other way as well, and it can breathe a little bit. But it allows and prevents the loss of that extra fluid that we see coming out of cells. And that allows the fibroblasts to stay, with no extra input for building up faster and quicker. If you don't have the water maintenance in a scar, the body says, we need more fibroblasts, we need more collagen. We have to fill that void in, and it does it rapidly to the demise of a good scar. It's already an out-of-control scar.